So I'm glad to be here. I'm honored to be here, honestly. I don't like the center of attention. Feels good though. I accepted this invitation because I trust the hostesses, the moderators, the beautiful women in the space that are guiding this conversation. And so I feel at home. It's Querencia.
Thank you so much, Maria. And thank you for sharing with our audience the meaning of Querencia, not just from a perspective of translating it into, from a word or a definition, but showing that Querencia means land, it means family, it means health, it means everything that's dear to our hearts as people, as New Mexicans, as it, encompasses all those values that we have as a community, as a people, and all the earth and parts that make that up. So I really appreciate hearing your beautiful words. And I'm so honored to have you, Maria, and have you, all of your, you being able to share your knowledge, your experience, and really helping us connect and making those connections between the environment and health and public health, and really bringing those intersections together so that we can understand health and then, public health in a more holistic fashion versus, the environmental being different and being separated. And I think that topic in general, from an Indigenous perspective, from a New Mexican perspective, land is health and our environment is health. And we always talk about social determinants of health and place and the importance of place. And now we have you to come and really make those connections just across the board through your experience and through many of these projects that you've been working on. But I want to leave it to you to give us, environmental 101, what is from your perspective. And yeah, I'll leave it there for now.
Thank you, Dr. Roybal. When I hear the words environment, environmental health, environmental justice, health, holistic health, all those words that we learned somewhere along the way, it takes me back to, being a young girl living on the farm. I grew up in San Miguel County, one of the poorest counties in our poor state, right? Poor in some economically derived, some in some ways poor, right? But in other ways, very, very rich. But so growing up on the land, in rural parts of New Mexico, we always had food and food to eat because we grew our food, meat because we raised our animals. But I can always remember the juntas up north that I used to go with my dad. We'd hop in the car, the truck at night and end up somewhere. But it was a junta, right? And the juntas were about the water and the land. We'd end up in the mountains, up in Mora, behind Mora, between Tausa and Mora, and all up and down La Española, all those places, right? But the juntas were about the land and the water, and not just the water in terms of who gets to use it or who owns it, which is a very strange concept, but the quality of the water. And those words weren't used necessarily, quality, but the conversations were about, is the water good to use? So our people know, we know, is the soil good to grow? So thinking about those very, very early memories in my life sort of shaped my perspective of how I operate. And no matter what, I always come back to those moments of asking these questions. Who gets to make these decisions for us, our people? Then by us, I mean the brown indigenous people of New Mexico. And now with our refugees and other families who come from other places experiencing, you know, the need to leave for whatever reasons and coming to New Mexico. I think about those days at the juntas by the acequias, you know, with the mayordomos and with, you know, all these different places that my dad would take me, and I'd hear the conversations about the water and the land and you know, where the cattle could graze and who could grow what and where could, you know, where could we do the cambalache, where could we, you know, trade our goods. And, you know, fast forward to kind of who I am now, I look back in retrospect and I think our communities have always been talking about the built environment, the natural environment, not distinguishing one from the other, but really just the environment and the place, our place, right? And how our place took care of us if we took care of it, took care of her. So that's sort of the, you know, like the frame that I always think about in my work, no matter what my role is. I always go back to those moments in my early socialization as a human being, right? So I think about, you know, the old men and the women and, you know, the conversations about, you know, what wasn't working in our communities. But I also remember folks passionately talking about ways that the communities could be better, you know. So, I mean, we've always been able to know what our challenges were in our communities and environmental health and our personal and individual health, our community's health. And we've always, you know, had ways to, or ideas of how to, you know, present those challenges. Somewhere along the way, you know, barriers became a thing. And I think some of those barriers are policy, right? And so moving into environmental health, the built environment, our natural environment, it's for the policies that sort of hold our communities back or don't let us be all we can be in our communities. Some of those policies are, you know, hundreds of years old. Some are not so hundreds of years old.
That's absolutely beautiful, Maria, and I really relate to that, especially as growing up in northern New Mexico myself, in Taos, and being from a family that was very similar to what you mentioned, you know, raising, having animals and gardens and things like that. So I think that's absolutely beautiful. I just wanted to say how much I appreciated those words. I mean, it just really resonates, definitely.
Yeah, and I think, you know, being in space with all you amazing, wonderful women, you know, it feels comfortable to be able to just speak about like where I'm from, because I think when we're in our, you know, modern day lives every day, we bring that with us, but we don't always get to, you know, to just shout it out. So
it's also important to note that most families and individuals living in the city of Albuquerque actually come from northern New Mexico. And they had to leave their land, which they farmed, and their environment and their water and their acequias and all of their traditional farming, food practices when the state was converted, you know, through annexation and all of these different pieces. And it made it almost families weren't able to survive off the land like they did for centuries. So, you know, instead of this barter system, New Mexico was kind of converted into, to the dollar system. And so it kind of changed the way the relationship that communities had and the way that they were able to, you know, farm and live off the land and raise families. And it disrupted these food systems and the environment in general. And now we see in 2022, we see some of the largest, the city of Albuquerque is the largest tribal population, or the second largest almost in the United States. We see that it is home to, you know, a great majority of younger generations of New Mexicans that have roots in northern New Mexico and actually across New Mexico that come from these rural communities that once had these very complex systems for food and farming. And so the city of Albuquerque and Bernalillo County is made up of all of our descendants and our community members and our children and ourselves, right? University of New Mexico is one of the largest hubs for education. So many people leave rural areas to get an education. So we are very much what make up, you know, the city. So, and all of those pieces we bring with us. And so I'm just really grateful that you have pointed that out and made that connection, and why environmental health and the environment and food systems and healthy food systems, what that looked like prior, and what that's, you know, the effects that it has now. And I know you have such a wealth of knowledge, Maria, working with all of these, you know, areas, including asthma and just all of the pieces that go into it. So I want to pass it back to you and just, you know, let you take us to our next area. I feel like I have a visual of what that was like, you know, back then. And it does bring back a lot of memories. I live in northern New Mexico now, but it brings back a lot of those memories of what that was like and how important that's still part of us, and that is us, and we are part of that, and we don't have that separation from the land. So a traditional New Mexican, a traditional indigenous perspective is we are one with the land. We are not separated from that. So anything we do to our environment or the land, we also do to ourselves. And so that's why it is so important, critically important, that we're constantly, right, taking care of our environment and our water and all the things that give us life. So back to you, Maria. Thank you.
Yes. Poignant points there, Dr. Roybal. You know, as you and Diana were sharing, it prompted me to think about, you know, you mentioned like social determinants of health and root causes, and, you know, prep conversation we had. And I think I would be remiss if I didn't, you know, make this statement that I never felt poor or out of place until I left my land. You know, I moved into town to go to college at Highlands, and then ultimately moved to city of Albuquerque as a young adult. And it wasn't until then that I really felt isolated. I didn't feel like I could find the food that I could eat because I was very picky, and I still am, about where my food came from. And I had a really, really hard time adjusting to, you know, being in the city and being so disconnected from not just the food and the land, but just the querencia and just the unspoken understanding, you know, as we work our land together and we take care of our water and our soil, and, you know, rotate our crops so that we, you know, have healthy soil, and, you know, try to minimize pollution in the air. But it wasn't until I moved to the city that I felt very isolated. And I wanted to point that out, because when we talk about, you know, root causes or social determinants, like those are some of the things that we need to think about, right? Especially the women. Women play such a critical role in many of still in our rural communities, right? If we want to call them rural communities, in decision making. And even though there may not be a formality of a title or an office, the women are still running the show. And we know, I mean, if we want to talk about environmental health and public health, we need to consider the women in this movement and what that means. And I'm not just talking about the individual health of the woman, but really the whole health of the environment.
Thank you, Maria. That's so critical. And it goes back, yes, to very, very, very traditional times. But now when we're thinking about the women in these roles and the importance. I know that in some areas, and I don't know the specifics in Bernalillo County, but we see large percentages of single women-headed households, and also a large generation of grandparents raising grandchildren. And those are the individuals who are seeking food, seeking systems, seeking, really trying to build capacity among their family to have all of those needs met. So I think it was so timely, Jessica, that you joined us with the Roadrunner. I kind of just want to even take a second and turn to you, because you really have been a lifeline through the food bank for many of our families and many of our children, and even coming, through COVID, and trying to get resources, and how important that is. I'm sure what we're speaking about now, you're probably seeing on the ground on a regular basis. But I just wanted to maybe give you if you wanted to share anything with us, Jessica.
Yeah, well, thank you so much, Dr. Roybal. And it remains utterly fascinating for me as an individual who was not born and raised in New Mexico. I was born and raised in the Great Lakes area. When I hear these experiences and journeys, as a non-native New Mexican, I get pulled in very strongly to these experiences of how people had grown up and what they remember about the land and the connection to the land, particularly in New Mexico. So Maria, thank you so much for sharing that. It really, in a very emotional way, really fills my heart when I hear it, and it helps to connect me with the work that I'm undertaking at Roadrunner Food Bank of New Mexico, as well as some of the other matters within the state. Certainly, you made a comment, Dr. Roybal, about COVID-19 pandemic and working through a lot of different aspects to supporting community members in New Mexico, fellow friends and neighbors, as I call them in New Mexico, through this experience of COVID-19 and global pandemic, and seeing a lot of the food and nutrition insecurity needs shift throughout the pandemic. And also to see that there were a lot of new fellow friends and neighbors who needed access to food and nutrition support. In addition to really having a staff within a food bank setting who really had to prepare, as I'm sure we all did in our roles, in interacting with community members. Even though we have a very stated mission, we're kind of known as the food people, but having to interact and wanting to interact and to do it in a meaningful and respectful and culturally safe and sensitive way, that during this pandemic, there's been a high level of distress and crisis, and a lot of concerns and worries expressed by community members, which has really moved our organization to thinking a lot about how do we interact in these situations with stress and chronic stress and distress and sometimes crisis situations, and really thinking about the intersectionality of other kinds of needs that we are all very much in touch with and know very much about. And so in my role under the Health and Wellness Initiative at Roadrunner Food Bank, we have been taking a lot of steps and measures to think about when we are serving a community member and we know the stated issue is they need some food in their household, but they're also presenting with many other concerns and priorities and other challenges going on in their lives. What is our responsibility? What is our capacity? what is our ability to interact and to provide additional support to that community member. As the programming within Roadrunner Food Bank that oversees food distribution in partnership with the healthcare partners in the healthcare delivery system. And there's a lot of discussion about social determinants of health, structural determinants of health, health-related social needs. It's been a very natural fit within the program to think about and to respond to and address and to develop how do we make sure that we're providing some kind of not only support, but a response to that community member who may be experiencing other kinds of issues and challenges going on in their lives. And I think that's something we're really building and strengthening at Roadrunner Food Bank. So I hope that was helpful for everyone.
Thank you, Jessica. And if anyone out there is looking for resources, how can, give them, I guess, a little bit of information so that they can find you and find your agency. So if you want to, yeah, thank you.
Yeah, that's great. So Roadrunner Food Bank is a nonprofit organization, like many organizations, does have a website. So you can always connect with us through our website at www.rrfb.org. If internet access is difficult, as it is for many fellow friends and neighbors throughout New Mexico, and you have access to a telephone, you can give me a call directly. And my telephone number is 505-349-5342. That's 505-349-5342. And if you are needing help with not only how do I get some food, but I'm also struggling to pay my rent, or I need some help applying for SNAP, or I need some help applying for Medicaid, or I just need someone to talk to about the challenges going on in my household or with me and try to figure out how to navigate this, you are always welcome to give me a call.
Thank you, Jessica. Thank you very much for sharing that. And part of this outreach is to get that information, into the public, and that, there are resources and there are help out there. But there's also probably opportunity to volunteer or individuals who are interested in supporting these types of efforts. So having your number and having that out to the public, I think, is really helpful. So not only if you were needing resources, but you wanted to be part of these types of solutions and you're interested in learning more about food systems, this is also an opportunity for viewers out there to join in these efforts. We are seeing food deserts at greater, levels here in the city, and this is an issue that's been coming up for quite some time. And so I'm really grateful to have you here and kind of share that. We also say, food is medicine, and food is medicine, and it's part of that. It takes us back to what Maria has been sharing about the land and the importance and farming and the importance of our environment, because this is what produces our food and how far we've moved from these systems. You also mentioned, there's lots of policies, and Maria, you mentioned earlier about policy and how many of these policies are affecting individuals on the ground and what this looks like for us now today. And I'm going to hand it to Diana.
Thank you, Dr. Roybal, and thank you, Jessica, for sharing that information. It's so valuable. I always, part of that conversation of we're a different world right now. Some people say that want to get back to the way it was or normal, but COVID changed things and brought a lot of things to light. And I just want to share and thank you for all the work that you and your staff have done as well. It's tremendous work. Thank you, Dr. Roybal, for that segue. And Maria, I just would like to know or give you the opportunity right now to just tell us a little bit more about the work that you all are doing at the city around environmental health.
Yeah, sure. Thank you, Diana. So we can take a hard shift to that. But it's important to sort of share my beginnings, of the journey to where I'm at, and hopefully you see the connection. So as I mentioned, I work for the Environmental Health Department in the city of Albuquerque, and the mission of the department is to responsibly and professionally serve the people of Albuquerque by promoting and protecting public health, by preventing disease, and by preserving the integrity and quality of our environment through sustainable management and responsible stewardship. So that's, the mission of the department. Some of the programs under the Environmental Health Department include sustainability. There's an Office of Sustainability, food inspections and safety. So, restaurant permits, food truck permits, temporary vendors at an event want to sell food, those types of things, inspections, and safety around food handling. Pool inspections and safety, testing our municipal swimming pools so that they're safe and clean for families to use. Sharps disposal, I highlight this because the Health Equity Council is actually like the main partner in this part of the environmental health programming. Health Equity Council provides training around sharps disposal, pickup and disposal. So I want to highlight that. The city environmental health program also includes mold, though the city doesn't directly have the ability to sort of address mold problems. They have the resources to direct people, especially renters, around mold. We have a program under urban biology, which deals with rodents, coyotes, mosquitoes. We just had the department just issued a press release a couple of weeks ago about West Nile virus and mosquitoes in Bernalillo County. So those types of programming fall under urban biology. Noise, we do noise monitoring, noise permitting for events. There are, some things under the noise ordinance that aren't covered. For example, airplanes flying overhead, we cannot control that or monitor that for those purposes. Landfill and groundwater monitoring and air quality, which is something I really want to sort of dive into. But all of these programs you can find on the City of Albuquerque Environmental Health website. And if you choose to peruse the site, there's a lot of great information about the program specifically. Air quality. Before I go into air quality though, I do want to share that the Environmental Health Department has a new director, Angel Martinez. He's been on about 6 months, I guess, 5 months. He started right before I did. And he, in prepping for this conversation today, I asked him if there was a specific message that I should deliver on behalf of the department. And he asked me to deliver a specific message on his behalf as the director of this department. And that is, his commitment and his main focus is equity and environmental justice. So I'm going to say that again. Our director's main focus is equity and environmental justice. So he is looking at internal policies, external policies, how across the board, right? Not just specifically around air quality, but across the board in the Environmental Health Department and how we operate and how we interact with the public. We don't have time to get into specifics. Perhaps at another time we can have him on for a very specific topic, and he would be the best person to really dissect and get into those, especially regulatory and policies. He's well versed in that. He's well versed in risk analysis, for public health. So just an FYI, he's a good guest to think about on your list of folks to invite. But he wanted me to deliver that very specific message. He has identified that policies are some of the policies that exist, whether they're federal, state, local, internal, are inequitable, do not serve the community in an equitable way. And so he's committed to, in his time in the department, making changes. some of the, maybe I'll just pause for a moment there because that's a big piece. But in sharing that, I would also like to share, and again, this is with his blessing, he has decided to add one more division under environmental health programming, and that is the public health division. And so that's brand new. He will be hiring 3 positions, well, actually 2, because he put me under that position, which I'm very excited to be part of. And I think that came from just many conversations I've had with him in my short 5 months with the department around the importance of thinking about the big picture, the health of the community. And I've got to know Director Martinez a little bit, and I see that he is truly committed, within his powers to, address some of the structural challenges in terms of policy. So I'm excited for this new division. There will be a couple of jobs related to the new public health division posted in the coming months. So look out for those. And as soon as I get my hands on them, I will share them out with the folks.
That's absolutely fantastic and so exciting to hear. I mean, this is just wonderful, wonderful. And
I want to jump on. We had a conversation early, Maria, and you shared a data point around, so I'm gonna push you in that area of air quality. You had a very specific data point for the city of Albuquerque that you shared with us, and why air quality is so important. And I want to make it very clear to our audience the connection, because sometimes we talk about structural, but we don't define it. We talk about justice, but we don't define it. But I think through this data point alone, and I'm pretty sure you know what I'm aiming towards, that speaks to that. That's where our audience can really understand and make that connection. So I don't know if you wanted to talk about the high schools and missing related to asthma.
Yes. So let me say this. How I got to the City Environmental Health Department actually started while I was working for the Health Equity Council as a health promotion specialist under the Public Health Initiative. And one of my first assignments early on was to work with the city's environmental health department to address or to do some research around asthma and air quality. And so that's sort of how I got connected to the department. So I feel like I need to provide that context. And so through the Public Health Initiative, we were able to, do a policy brief, a 1-pager on asthma as a public health response, and then also one on asthma and air quality, which is the one that I worked on, and come up with some recommendations, which were then submitted to the city of Albuquerque for consideration. So coming into the department, I sort of had that knowledge with me. I came into the department thinking I was going to be right under air quality. That was going to be my work day in and day out. It turns out a community liaison does a lot of other things. But I have held on to the air quality stuff because it's super important, and for a couple of reasons. One, a few months ago, I guess in May, at the end of May, early May, mid-May, I was contacted by a person from APS in the administration with concerns around the air quality, because of course that was a time when the fires were just really ramping up in northern New Mexico, and the smoke was settling here in the city. And, with some of the ozone concerns that we have, aside from smoke coming from somewhere else, all of that, was really causing some bad air quality days here in the city. Bad in terms of the national air quality standards, right? Not something that we just arbitrarily decided oh, it's a bad day, you know what I mean? So, I met with this woman, and she was from the Family Student Services Support, something like that, division at APS. And we had a conversation. And it was through that conversation between her, myself, and the director of nursing at APS that I found out that asthma-related illness is the #1 reason students in Albuquerque public schools miss school. And that really, really stuck with me, you know? And I mean, we didn't get into like the details. I mean, I'm very curious, you know, what sorts of, you know, what does that mean? Does that mean the student is ill? Maybe not. Maybe it's the parent or the guardian who can't drive them to school because they're ill, you know? So there's a lot of ways that that can play out. So I approached the director at Environmental Health and I asked, you know, can we do some education around asthma and air quality with our schools, you know? Can I do outreach there and, you know, just provide some basic education so that families can work with the schools to amend their health plans so that their students are able to be successful in school. You know, that if there's a day where the air quality is bad, they're not forced to be outside. I worked with families to sign them up to receive health alerts so they can make individual decisions, right? Based on a health alert that's issued by the City Air Quality Department program. And so, you know, that's something that I'm continuing to work on. I've identified several schools that I'm going to need some personal outreach to. And just my mission is to help folks get signed up. That's the first step. And, you know, hopefully build an education program around not just outdoor air quality, but indoor air quality. You know, there's a lot of concerns around that, you know, the City of Albuquerque Department, you know, did away with. They used to do a lot more programming, a lot more engagement in the community, but somehow through different changes in leadership and whatever, you know, those sorts of things kind of went away. But Director Martinez is committed to bringing those pieces back. And I'm committed to helping build that educational piece because, you know, for example, when it's cold and our families are burning wood, you know, sometimes it's not because it's for the ambiance. It is a necessity. That is the sole source of heating the home. But it's also unfair to sometimes hear the narrative that, oh, it's those families that burn wood that are causing all this brown cloud in the morning. That's not completely 100% true. You know, there are other factors. So, you know, I'm really committed to it. Those things, those educational pieces with community and the department, right? I think it's a give and take. There's so much in our community that we could bring to governmental agencies and lend that expertise from a different perspective and offer solutions, right? I saw Chris Hatter had that.
Oh, Maria, it's interesting. I think your idea of the education and everything is really interesting. And I know that it's a complex issue. Asthma at the end is like a simple consequence, but at all of the reasons. Would you see, especially with your new directors, thinking about policies and everything, would you see in your education programs bringing up to parents and helping them understand the kinds of policies that either the city has or the county has, or even the state for that matter, that are having this major impact in a negative way on their children's health?
I think that's part of the whole education, right? I'm trying to get my foot in the door, you know, be strategic about it. There's always a game plan as far as I'm concerned, but I always have the end goal in mind, and that is to provide as much education and resources so that our families have power, you know, whatever that means at whatever level.
There's a lot of research that demonstrates indoor air quality in low-income housing is very much related to childhood asthma. So that would be another area, you know, apart from, you know, just the air quality, you know, through the fires and things like that, but really looking at housing and how, you know, you have a department that works on mold. And we see some of even the newer apartments in different areas in the city of Albuquerque that have issues with mold, or you'll hear tenants or individuals talking about not having the resources or not getting the results when it's reported. So I know Abigail Sewell out of, I want to say Emory, Atlanta, has quite a bit of research connecting, you know, housing, childhood asthma, and policy. and the impacts. And that might be something that might be, you know, of interest to kind of even look at the models for the city of Albuquerque, you know, to see how much of it is actual air quality and to see how much is indoor. And, you know, what population of students, being that it's the #1 cause of students, you know, missing school. That is such a surprising statistic, you know.
Yeah.
Thank you, Jessica. It was a pleasure having you with us today. And if you, you know, reach out, audience, to the Roadrunner Food Bank. These are our neighbor, and they're very much on deck and supporting our community. So thank you.
It looks like we're coming to a close.
We are getting closer. We are. This has just been like a really wonderful conversation, Maria. And there's so many aspects and areas that I like, questions that I have for you, because I just think it's your community outreach and some of the pieces that you do are really critical. And I was just wondering if maybe before, maybe, you know, you can give your, you know, your not your last comment, but if I could ask you a last question before we get too close to our last comments, but just really about the importance of community outreach and the role that it has in environmental and in public health. So that's something I would, you know, if you could even almost define or describe and for us, like what that looks like. I think sometimes when people think about public health, they think about people in an office, you know. So I kind of want to, you know, let you talk to that. And thank you.
Yeah, that's the best part of in my from my heart that I feel my work is the community outreach, the community engagement, the on the ground, put my boots on, pick up the shovel and go out with folks, gather the stories, you know, if you want to call it data, whatever, gather the stories. By the way, Environmental Health Department Director Martinez has committed $1 million for our data. So yeah, he's serious. I mean, he's going to build up. He believes that public health needs to be, and health data needs to be part of the environmental health programming. So I want to slip that in there before I forget. Yeah, community engagement. I mean, there's no other way than to like touch, feel, smell, just be, you know, with people and be in community and be able to listen. I mean, we are all part of our community, all of us, you know, whether we're in a suit and a tie or, you know, our Dickies and hard steel toe boots, you know, we're all part of a community. And we're short on time, but I am going to leave this example of community engagement for a future topic of conversation that we really need to dig into. And that is with the Health Equity Council's Neighborhood Food Hub project. And all that encompasses, you know, working with the Urban Ag Project, Bernalillo County Urban Ag Project, the Food Hub, and especially the Citizen Science Air Quality Monitoring Project, which Bridget Yanis and I are co-PIs on, and something that I have been able to bring into my work at the city. Hold on to that project. It was so important for me not to let it go. Whether I transitioned out of the council into a new role, it took me a couple of months to figure out how to make it part of my work. But I felt that it was a really important piece of community engagement. You know, there's so much, you know, and I hope that we get to have a deeper conversation with other partners around that program because it's such an important program. I personally feel like if this program, so this project was funded by EPA, an Environmental Justice Small Grant. And, you know, the one part of it, the air quality part, is the one that I'm really invested in. And the reason that I'm so invested in it is I feel like if we can, the Health Council and its partners, now me at the city, if we can break through this threshold with the Citizen Science Monitoring Project and have data gathered by community that owns the data, The city doesn't own it. This project, the Health Council, the people own this data. If we can just break to that threshold, it will open up an avenue for other communities in the city, in the county, and across the state to then fund and do their own citizen science monitoring, air quality monitoring. And because this is EPA funded, we have an EPA technical assistance provider. And so walking us through all aspects of the quality assurance project plan, which then validates any data collected in EPA's eyes. And so that's why I'm so invested in making this project go. Right now, the monitors are at one of the city monitoring sites being co-located. And what that means is they're being checked for their performance against the city's air quality monitoring system. And they'll be calibrated in the next week or two. And then they'll be put out in the community. So stay tuned. That's another hour topic to talk about because it's really exciting. And I'm like super, super invested in that one. And I'm not going to let that one go. So.
Maria,
I'm handing it off, but handing it off behind the scenes, I'm doing a lot of work, but I see the value in power that comes with that project.
Absolutely. And that just sounds fantastic. And the power and the possibility of that ownership and, that the community voice and, I just feel like that's absolutely fantastic. And please, if there's anything that we can help out with as well, health promotion, obviously Health Equity Council is so wonderful in helping out on or working in those projects and collaborating as well. And, I know we're kind of winding down to our last minutes, but I just want to acknowledge how great this conversation has been tonight. And I think we set up actually like a few more episodes going into the new year. So, this is, conversation to be continued, which is great and what our goal is. So, from the bottom of our hearts, Maria, we want to say thank you for bringing this wonderful message to us tonight. And on Facebook, we had, I think I saw like 7 people were on. So that's awesome. We're building up our viewership. So we just want to say thank you so much. And we just appreciate you for all the work that you're doing and bringing this work with a whole heart. So thank you so much. And Dr. Roybal, is there anything else you'd like to add?
I kind of want to thank you so much, Maria. Thank you for joining us. And we're going to have more conversations down throughout the next 6 months, or basically, and throughout December. So we have some really awesome guests lined up. And I kind of want to give a little teaser, Maria, because I'd love for you to join us. In the next coming months, we'll send out flyers and let people know. We'll be having a talk on healthy masculinity and the importance. We have 2 really important guests that are going to come on and talk about their roles in the community. And then we're going to move into culture as health. So we are going to talk about Dia de los Muertos and a lot of the different cultures in the month of November. Actually, we're going to do this in October prior to. So we're going to have some of our guests from the community that work on all of these different, and the importance of, I think sometimes, in Western medicine and in academics, we separate culture from all of our other pieces, and we separate culture from health. And so October is culture and health. And let's see, November is healthy masculinity. September, we're going to be having harm reduction. And December, which I'm very excited about, we are going to talk about traditional alternative healing, traditional medicine. And so bringing on some of our guests. And I'd like to use the terms more traditional medicine and that role that it's played in Querencia, in Salud, in New Mexico, and as a very viable piece that our community has really held on to in the wake of a lot of health disparities. And so stay tuned for our guests and being part of that conversation. And if you're watching here tonight and you think, you know what, there's something really important, or you have something to share, or you would like something, you know, a topic for us to cover, please reach out. And you can find us at the Health Equity Council online. We have a general email box there. I know I can't, on Facebook, I can't put this in the chat, but in the comments, I can put Anna or myself, our emails there. But please reach out, you know, if there's something that, you know, or somebody that should be on it. And we would love to host. And so again, Salud y Querencia is about our community, for our community, by our community. So I want to thank everybody this evening, and please join us in the future. So, kundawaha, good evening.
Thank you, Anna, Diana, Dr. Roybal.
Thank you.
Thank you, everyone, for joining. Chris, Janice, everyone.
Janice. Adios.